Okay, so the news broke yesterday that the mandates end. So what do you think made Bonnie decide? Like, she's like a czar, our health czar. Whatever she says goes. When she says no mask, we listen. When she says, whatever her rules are, we listen. When she says close the churches and gyms, close. Keep the casinos open, all the things that I got in trouble for when I was at Global trying to say, well, what is she talking about? Where's the sense? Why do you think this news came down yesterday? What was the motivating factor that made her make this change, do you think? Well, I'll get both your opinion.
We have an election coming up.
Lots of people talked about the election.
And I think right now the NDP is actually taking a number of positions that they held and reversing on them, because they're still too controversial for them.
But do you think this will help the election?
The drugs is one thing. I think that recognizing that we have a shortage of healthcare workers still is where we need these healthcare workers.
I know, but they let us go. They let emergency rooms close down. Adrian Dix just let it go. Remember, he was sending cancer patients over the border to get treatment in Washington. Nobody's going to look fondly back on this. So other than, what do you think of the news, well, Dr. York, that it came yesterday? Like that, do you believe that this is an election thing?
Absolutely.
Oh, okay.
The reason why it came on a Friday is because they were hoping that by Monday everybody would have forgotten what they said on Friday. This whole thing is completely determined by, I would say, public pressure and how the polls were making the NDP look like they're losers. So the NDP has steadily lost ground. They continue to lose a lot of ground. And over the last 2 weeks, probably what hasn't been spoken about very much in Vancouver and Victoria is that the hospitals in northern BC, they are decimated. There are so many hospitals on diversion. Diversion means that they have closed their emergency rooms. From Merritt to all the way to the Alberta border, all of those hospitals are on diversion. Something has to break.
Yeah, the mayors have been, calling out for this to change.
That's right.
The mayors have been calling out.
Yes.
What about pressure from the Conservative Party, John Rustad? Do you think that's having an effect? He's gaining momentum politically.
I think by themselves, no. I think the NDP largely ignores what John Rustad says. I think that they would be more persuaded by what the pollsters are saying. Perhaps to some degree they're be guided by what their union members are telling them. Their union bosses are having, I imagine, difficulty persuading nurses to stay in line, to not talk out about how terrible working conditions are for the nurses, why they are so short-staffed.
They just put up with it.
They just put up with it, is right.
Okay, and now let's talk about a little bit about what people have gone through. In the past few years, like even people going to school couldn't finish their education if they didn't take it, and they spent a lot of money going to school. People lost, of course, their jobs. I've talked to a lot of nurses that then got a job in a deli. I was a director. Right now I work in a medical clinic, right? You know what I mean? It's totally fine, but my life changed, but it got better. But a lot of people suffered with this. I mean, so what do you say to that? Like, there's been a lot of human suffering. And also, can I ask you just how does this impact, Bill 36? Also, is that done and dusted? Bill 36?
Oh no, Bill 36 is, it's enacted this year.
But how does it work together? How can you lift mandates and enforce a bill?
It dovetails into Bill 36. In Bill 36, there is a section talking about mandatory vaccination for all healthcare workers. Bill 36 is currently law in British Columbia. And so
all these things with the fines and the this and the that and that you have to do what they say. I've read parts of Bill 36. That's still in effect?
Oh yes. Oh yes.
So by Bonnie blowing the mandates away, is this phony baloney? I don't understand like what you said about the dovetailing of Bill 36.
Right. I think in a way that this is phony baloney, because the NDP government has to do something. So they want to come across as being conciliatory. to the unvaccinated healthcare workers in order to bring them back. But at the same time, they want to keep the hammer down on them by bringing in new requirements of needing to know the vaccination status of all the healthcare workers.
Somebody commented on that you still have to report your vaccination status. Well, what's the point of that?
Well, that's simply so that when the next pandemic comes along, they can make the requirement that you're vaccinated. And if you're not, then they have the grounds to basically protect the other healthcare workers and presumably the patients from those individuals. That's the rationale.
Do you think that the healthcare industry is going to look at the way people feel about vaccines and rethink these policies? I
think the public has already done that. And when you look at the compliance for getting booster shots for COVID-19, the public isn't doing that. I mean, we disposed of over $1 billion worth of COVID-19 vaccines the year before, and then in the last year we did the same.
Who paid for those vaccines?
Oh, the taxpayer paid.
The taxpayer, yeah.